Namaste, myself Dr. Harshavardhan. In this video, we will be seeing how a bipolar resection is useful in management of a uterine polyp. This particular patient is a young female who presented with pain and heavy bleeding during her menstrual cycle. A ultrasound scan was done, and ultrasound revealed a 2 centimeter polyp. You can see the endoscopic view here. It's a large polyp, and you can see the remarkable condition on the polyp. So endoscopy was done, and it is imperative that during the initial part of the surgery, a thorough inspection of the polyp and its relationship with the surrounding structures like the anterior and posterior and the lateral walls, and also the ostia should be done. A note should be made regarding the size of the polyp's base, if it is a sessile or a pedunculated polyp, based on which we can choose our treatment plan. Initially, we thought of resecting the polyp with a scissor via the hysteroscope, but as the base was large, we had to plan for a resection with a resectoscope. Here you are seeing a bipolar resection of the uterine polyp. A bipolar resection is always advantageous over a monopolar resection in terms of less bleeding, and the cutting with bipolar is beautiful. It is like passing a nice knife through a piece of slice of butter. So, and also the major advantage of using a bipolar is we use normal saline here. So the risk of having a post-operative hyponatremia is very less. Coming to the surgery per se, as it is a large polyp, we need to remove it piecemeal. Had it been a small polyp, we can directly resect it from the base of the polyp. But in these cases, it is always better to start the resection from the lateral border and move to the center. And also, the resection is done in a retrograde manner, inside out. So once you start resecting from on either side of the polyp and move towards the center, it will give a beautiful space. The space is created and we can reach the base within no time. As you can see, as we are progressing through the surgery, there are small chips that are being removed. These chips need to be evacuated so as to have a good vision on where we are proceeding with surgery. Once we think that there is an adequate resection done and we are almost reaching at the base of the polyp, it is better to slow down here because a over enthusiastic cutting at the base or on the lateral side of the polyp may result in inadvertent injury either to the lateral wall or to the posterior wall, which may lead to perforation of the uterus and we may have to open and do a major surgery. This procedure is a daycare procedure. It can be done and patient can be discharged immediately. As you can see, as I said, we're almost reached the base now. The funda here is to remove the polyp in toto along with the base. Sometimes what happens, especially at the apex of the polyp, it is difficult to do a retrograde cutting. In such scenarios, a antegrade cutting, that is from outside to inside, can be useful as being shown here. So a small chip by chip removal of the polyp has been done from the base. Now only the base is left. A complete in-depth resection can be done here so as to prevent recurrence. A good hemostasis is of paramount importance to avoid post-operative complications like uterine bleeding. For that, the Olympus Bipolar system has this wonderful loop. As you can see, it is a button loop or a mushroom loop with which you can do beautiful coagulation, and also it helps in vaporization of tissue. So if you find some residual tissue which you feel to remove, you can use this loop for vaporization.
Hello, this is Dr. Supriya, consultant gynecologist, Sudha Hospital. As you have seen in this video, this procedure is really a boon to the infertile patients because it is a minimally invasive procedure, a daycare procedure, and it is done under vision with a minimal collateral damage, unlike the routine or a conventional DNC, which was a blind procedure. Thank you.